Diabetes is a disorder when blood sugars are running high, and there can be multiple reasons why somebody may develop diabetes and have high blood sugars. There are many types of diabetes. So the two main types of diabetes are type 1 and type 2 diabetes. Type 1 diabetes is an autoimmune disease. It's a disease we usually see in young children, but actually it can be diagnosed throughout the whole lifespan. And it's when the body destroys the cells that make insulin. So it's sort of like you fight off an infection. The body decides it's going to fight off those cells that make insulin. Type 2 diabetes is different. It's when you make lots of insulin, but you're resistant to it, so you can't use it properly. It's what we usually see in adults, but we actually diagnose quite a few children with type 2 diabetes as well. Other types of diabetes may be gestational diabetes, which you would see in a mom who's pregnant. You may also develop a form of diabetes called MODY, which is a very genetic type of diabetes. And then some medications can lead to the development of diabetes as well. There is certainly an increase in the diagnosis of diabetes. Diabetes is the 8th leading cause of death in the United States, which makes it a public health concern. 11% of our population in the United States has diabetes. Not all of those people may know that they have diabetes, so it may be asymptomatic this time. And that number just keeps climbing, likely related from a type 2 standpoint to the obesity epidemic in our country. And it is associated with a lot of complications that require lots of medical attention. So it can lead to heart issues, it can lead to eye concerns, it can lead to kidney failure, it can lead to neuropathy, and all of those can lead to complications that impact our patients. The signs of diabetes are drinking a lot, urinating a lot, eating a lot, even with weight loss. So you may be eating a lot and then all of a sudden lose a lot of weight. That is certainly a sign that blood sugars could be running high. Some people may also get headaches. They may also have infections that don't heal well, may have numbness and tingling in their hands and their feet. All of those could be sign of diabetes. If we have somebody who has a family history of diabetes, whose mother or grandmother had diabetes, that certainly places them at increased risk for the development of diabetes. And so understanding that risk and impacting that risk. So by eating healthy early, watching their weight early, getting engaged in physical activity early, can then prevent the progression for diabetes for that person. Currently, there is no cure for type 1 diabetes. Type 2 diabetes, we do have people who go into what we may say remission, and they change their diet, they lose their weight, they may see that they no longer diabetic by the numbers and can cure it in a way. I think most people would say it was more like remission, though, that they're still at risk for diabetes, but they have their blood sugars under control with diet and lifestyle. Between the ages of 35 and 70, anybody with obesity should be screened for type 2 diabetes. That screening can be done in multiple ways. It can be done with a hemoglobin A1C, which is a simple blood test, or it can be done through an oral glucose tolerance test, or with just a random blood sugar. For the adolescent population, we recommend screening for type 2 diabetes if they're over 10 or pubertal, if they're overweight or obese, and they have a second risk factor. For type 1 diabetes, screening has changed recently. We used to not screen for type 1 diabetes and would only diagnose it based on the symptoms. There's better understanding now that type 1 diabetes, there's a period of time when somebody has type 1 diabetes before they develop symptoms. And so for at-risk patients, they may consider screening with antibodies. And those at-risk populations are those with a family history of type 1 diabetes, or those that have very particular autoimmune diseases that may run with type 1 diabetes. So we are now moving towards more screening with antibodies. And the hope is that if we screen earlier, we may prevent the complication of diabetic ketoacidosis at diagnosis. And then some patients may be able to receive medications that may delay the progression. Long-term, though, the complications are associated with long-term high blood sugars. And that's the heart disease, kidney disease, damage to your eyes, damage to your nerves. Damage to the nerves may lead to amputations if you get infections that can't heal. So those are more of the long-term complications. That's what we're hoping to prevent. The idea of lifestyle medicine is that food and activity and physical activity are part of the medicine. That it's not just pills that you take, drugs that you inject, but that your lifestyle, what you do, is how you're going to help manage your chronic medical problems. What you eat is part of your medical care and part of controlling your blood sugars and your diabetes. So focusing there and not just relying on medications. And the goal is that if you can focus on your lifestyle, focus on diet and exercise, that you may not need all of those other medications. With obesity being one of the biggest risk factors for the development of type 2 diabetes, nutrition and the management of weight has one of the greatest impact on preventing the progression from prediabetes to type 2 diabetes, but also reversing type 2 diabetes. Simple carbohydrates do impact blood sugar, so we're trying to eliminate the simple carbohydrates, focusing on more of a complex diet. Decreasing your weight by 7% can lead to a 50% reduction in your risk for progression from prediabetes to type 2 diabetes. The biggest impact you can make is eliminating the simple sugars, usually in sugary drinks. So the regular soda, the sweet tea. That being said, we're not looking to completely eliminate carbohydrates, which a lot of people would say. It's really, we're focusing on a varied diet that provides all of the nutrients. In type 1 diabetes, we actually don't make huge dietary changes. We really try to just say, we want you to eat a normal, healthy diet, and we're going to give insulin for that.